A 56-year-old A was sleeping comfortably in her home when three men suddenly broke in and tied her hands and feet with ropes. They turned out to be nurses working at a psychiatric hospital, and they placed her in an emergency transport vehicle and admitted her to the hospital. It was later revealed that two of A's children had requested her admission for psychiatric treatment, and that a psychiatrist had diagnosed her as needing hospitalization, leading to her involuntary admission. In reality, A had only been receiving outpatient psychiatric care for menopausal depression. During the 1 or 2 months prior to this incident, Ms. A demanded to be discharged, that she had been forcibly admitted, even though she was not suffering from a mental illness requiring hospitalization. Nor did she pose any threat to her own health or safety or that of others. So, is it lawful to forcibly hospitalize a patient against their will under such circumstances?
Many people believe that individuals with mental disorders are aggressive and dangerous. According to a 2007 national survey on public perceptions of mental illness, 76.6% of respondents stated that people with mental disorders are more dangerous than ordinary individuals, showing that the public tends to hold negative views toward the mentally ill. So, can someone who has or is suspected of having a mental illness be hospitalized in a psychiatric facility without their consent? In many countries, regardless of the patient's own wishes, involuntary admission and extensions of hospitalization can be made based on the psychiatrist's opinion and the consent of a guardian. This is because many individuals with severe mental illnesses lack awareness of their condition and refuse treatment. How common is involuntary hospitalization among psychiatric patients? In 2015, about 70% of patients with schizophrenia or bipolar disorder admitted involuntarily to psychiatric or long-term care facilities in Korea. After the law was amended in 2015 to strengthen the requirements for involuntary admission, the rate fell to 46.1% in 2016. But this remains significantly higher than in advanced countries such as Germany, the United Kingdom, and Italy. Is involuntary admission for patients with severe mental disorders necessary? Some people support idea of compulsory hospitalization. First, many people are reluctant to seek psychiatric treatment even for minor issues. Therefore, involuntary hospitalization becomes necessary. Second, during acute phases of mental illness, patients may pose risks of self-harm or violence, yet most refuse hospitalization. Timely treatment can reduce these risks and help them return to society sooner. Third, cases like A's, where involuntary admission is abused by family or physicians, are said to be extremely rare. The problem lies not in the existence of compulsory hospitalization itself, but in how easily it could be initiated under previous laws. Therefore, instead of banning involuntary hospitalization altogether, the system should be improved by strengthening psychiatrists' ethical and legal responsibilities and tightening procedural safeguards. Fourth, families of people with mental disorders often endure significant physical and psychological suffering, and hospitalization is sometimes the only way to relieve that burden. In such cases, compulsory admission is seen as necessary for the protection of both the patient and their family. However, opponents of involuntary hospitalization also make valid arguments. First, forced admission infringes upon personal autonomy and human dignity, and should therefore only occur under strict standards. Furthermore, unlike physical illnesses, mental disorders often have vague boundaries and diagnoses, and rely heavily on subjective factors like patient interviews, mental state examinations, and third-party reports, making arbitrary or abusive decisions possible. Second, the current criteria for assessing the risk of harm to self or others are vague, and such risks are difficult to predict. Third, even if a person poses no immediate danger, they may still be involuntarily confined for the sake of public safety. This raises ethical questions about whether it is right to sacrifice the rights of a few for the perceived safety of the majority. The Constitutional Court of Korea has ruled that the existing involuntary admission system excessively infringed upon the physical liberty of people with mental disorders. Accordingly, in 2015, the National Assembly amended the law to limit compulsory admission. By the way, many people believe that individuals with mental disorders are violent. Then, is this really true? According to the Department of Justice, only 4.3% of all homicide cases in the United States were committed by people with a history of mental illness. Similarly, in Korea, data from the Supreme Prosecutor's Office show that in 2015, for every 100,000 people, there were 68.2 serious offenders among the general population, compared to only 33.7 among those with mental disorders. The reason many still perceive mentally ill individuals as violent appears to be the media's disproportionate coverage of sensational crimes committed by such individuals. How do you think about involuntary forcible admission in psychiatric hospital? Please leave your thoughts or opinions in the comments.